Hi, my name is Yesenia Anchonda. I'm going to be your student nurse today. How are you feeling today?
Thank you.
Perfect. I'm going to go ahead and provide some privacy. Alright, so first thing I'm going to do, I'm going to go ahead and show y'all my paperwork. I have my cheat sheet number 1, front, second page, and back. And then I have my cheat sheet number 2, front, and back. It's on, Christy. So I'm going to go ahead and put my gloves on before I begin. Do you have any latex, medication, environmental, food allergies?
No.
Perfect. So as you know, today we're going to be doing a full head-to-toe assessment. If you have any questions or need me to stop you, let me know, right? I'm going to go ahead and put my gloves on. So I'm going to go ahead and get some information about you. Some biographic data first. Go ahead and provide privacy. And can I get your name and your date of birth, please?
Married for September 8, 1990.
Perfect. And I see you don't have any other allergy bands. All right. And can you tell me how old would that make you?
29.
29. Perfect. And your marital status?
I am married.
Married. Okay. And can I get your address?
It's 2135 South Sting Drive.
Okay, perfect. And are you working?
Yes. No.
Oh, okay, perfect. So what brings you to the hospital today?
I have a headache.
A headache, okay. And then can you tell me from the time it started till now? Has it been getting worse?
It's kind of been staying the same.
Oh, okay. So I'm gonna go ahead and do a PQRST. Can you tell me what makes it worse or better?
When I lay down, makes it better.
Okay. And then can you tell me the quality? Is it sharp, dull?
It's sharp.
Okay. And can you show me exactly where the region
Right
is? Right there. Does that hurt?
No.
Okay. And then severity on a scale of 0 to 10?
It's a 4.
4. And then what makes it, how has this been affecting your daily life?
I can't, I have to take naps and lay down.
Oh, okay, perfect. And then, does it, can you tell me the timing? Does it come and go? Is it constant?
It comes and goes.
Perfect. And then, so do you have any other pain that we need to address?
No.
Perfect, okay. So I'm gonna go ahead and ask you a little bit of questions about yourself. Can you tell me any childhood illnesses such as mumps, measles?
No, I've
chickenpox?
never had them.
Perfect. Any chronic illnesses such as diabetes, depression,
No.
heart disease? Okay. And what about any auto accidents or accidents like burns, head trauma, especially if you had unconsciousness or
No, I haven't had
accident?
any.
Okay, perfect. And we did already ask you about your allergies. I'm going to go ahead and ask you a little bit about your family. Did your family have a history of diabetes, depression, heart disease?
No.
No? Okay. And can you tell me a little bit about the health status of your mom and your dad? Are they still living?
Yes, they're 52 and 55, and they're both in good health.
Good health. Okay, perfect. Okay, so now I'm going to go ahead and just do a functional assessment. Like I said before, some of these questions may be a little private, but this is just for us to get you some resources, okay? What is the last grade you completed?
Some college.
Okay. And is your family, is your financial status adequate for your living
Yes.
style? Okay. And can you tell me a little bit about your religious beliefs? Should we know a little bit about it for this healthcare? Okay. And then what about some self-care behaviors?
I take walks.
Okay. And then what about your, can you tell me a little bit about a typical day?
I wake up, I eat, I have class, then I eat again, and then I have class again, and I do some homework, and then I eat, and then I clean, and then I go to sleep.
Okay. And can you tell me a little bit about your sleep patterns? How do you sleep at night?
I sleep pretty good.
And do you take naps during the day?
No.
Oh, okay. Okay. So now we're going to go ahead and get into these private questions. Of course, if you have any other questions, just let me know. Do you do drugs or alcohol?
I drink.
You drink? Okay. On a typical week, how many days a week do you drink? One, okay. And on a drinking day, how many drinks do you have? One? Okay. And how big are your glasses?
They're like 4 ounces.
4 ounces. Okay, perfect. And then because you said you drink, I'm gonna go ahead and do a cage assessment. the cage assessment. Do you feel the need to cut down?
No.
Do you feel angry when people tell you what you're drinking or annoyed? Okay. And do you feel guilty about your drinking?
No.
Okay. And do you need an eye opener in the morning?
No.
Perfect. Okay. So now we're going to go ahead and do mental assessment. A, B, C, and D. Okay. So when I'm looking at your appearance, her appearance is good. She has good body movement. We see that her hygiene and grooming is good as well, and also her dress. Her posture as well is erect. Okay. For behavior, we see that she is alert and her speech is clear. It's not slow, slurred, or rapid. Okay. So I'm gonna go ahead and move down to T. We see that she is making sense lately, and for the suicidal, we're gonna go ahead and assess that on the next assessment that we're about to do. Okay. So now we're gonna go ahead and do a depression and suicide assessment. In the last 2 weeks, have you felt hopeless, down, depressed?
No.
Okay. In the last 2 weeks, have you felt less pleasure in doing things that you used to do?
No.
Okay. If she would have said yes, we would go ahead and do, we're going to go ahead and do a PHQ-9 test. Do you feel like hurting yourself?
No.
And if you did feel like hurting yourself, who would you talk to?
My husband.
Okay. Perfect. Oh, and I did see, we did not ask you a little bit more questions on your mental assessment. For the C, cognition, we did see that she is giving me remote and recent data. She did tell me her name, so she's oriented to her time. Can you tell me where you're at and what time it is?
I'm at the hospital and it's noon.
Hospital and it is noon. Okay. We see that she has been oriented to place, time, and she does have good remote and recent data, and she does have a good attention span, as we see. Okay. And then we're gonna go ahead and move down. We already did the depression. We're gonna go ahead and do a violence screening. Because domestic violence is so common in today's society, we are asking every individual these questions. And do you feel safe at home?
Yes.
Has your partner ever hit, kicked, punched, or slapped you?
No.
Perfect. And if she did, we would go ahead and do a danger assessment. Okay. So now I'm going to go ahead and I'm just going to go ahead and take some of your vitals. Is that okay with you? Perfect. Okay. So we're going to go ahead and start with your blood pressure. We're going to be doing a two-step method. Okay. So which arm do you prefer? And do you have any breast, axillary, any PICC lines?
No.
Any birth control in your arm or anything like that? Perfect. So I'm going to go ahead and put this around. Okay. Go ahead and put it right here. Alright, so I'm going to go ahead and assess her brachial pulse real quick. Perfect. Okay, so we're gonna go ahead and do the two-step method. We got her brachial pulse. And before I start, have you had any caffeine? Have you smoked? Had anything cold or hot in the last thing? No. Okay. Can I have your feet flat on the floor? Thank you. All right. So I stopped filling it at 120. I'm gonna go ahead and let that rest for a minute. Does your arm feel okay?
Yes.
Perfect. Okay, I'm gonna go ahead and clean this real quick. Alright. So let me go ahead and check your thing real quick. Okay. Alright, so just have your arm flat. Here. Okay. Do your arm feel okay still? Okay, perfect. And because it stopped at 120, I'm gonna go ahead and go to 150. So So I got 122/82. That is in the correct range. Normal range is less than 120/80. For pulse, it's 60 to 100. Respirations are 12 to 20. Oxygenation is 95 to 100, and temperature is 96.5 to 100.4. Okay. Now that we've got your blood pressure, go ahead and put it over here. I'm gonna go ahead and take the rest of your vitals. Are you still feeling okay?
Yes.
Perfect. Okay. So, can I get your finger? I'm gonna go ahead and clean the device. And I see that she does not have any nail polish. Okay. And this is also gonna get her pulse. I'm gonna go ahead and check her respirations while I'm here. Sorry. Okay, we did see her pulse is her oxygen is 96. It's in normal range, and her pulse is 85. It's also a normal range. Okay. Let me go ahead and check your respiration. So respirations, I got 9, which would be 18, so it is in normal range. It's between 12 to 20. Okay, we're gonna go ahead and check your your temperature right now. Okay, so I'm gonna go ahead and clean the device. All right. So, and I see that she's not diaphoretic. Okay. We got 98.2. It is in normal range. We got your vital signs over with. We're gonna go ahead and do a couple more assessments, and then we're gonna go ahead and start the physical assessment. Are you still okay?
Mm-hmm.
And I did address pain twice. You didn't have any other pain, are you sure? Perfect. Okay. So I'm gonna go ahead and ask if you could stand up, please. Perfect. We're gonna go ahead and do a Snellen chart, and her BMI, her weight, her height, and her waist circumference as well. All right. So if you could just please stand here, I'm gonna go ahead and do 20 feet. Okay. We're just gonna stop at 10, but it would be 20 feet. Okay. If you could just please stand here, and then I'm gonna give you this sheet, and then if you could just cover each eye, please. Okay. And tell me the lowest. What's the lowest line you can read?
It's EDFCZP, and the other eye is EDFCZP.
Okay. And then with both eyes?
It's CDFZZP.
Perfect. Okay, we see that she does have 20/20 vision, which is great. If she did have anything lower than 20/30, we'd assess you for an ophthalmologist. And I did see that you weren't squinting, leaning forward, or hesitating or missing words, so that is good. Okay, and if you could just please come over here. I'm gonna go ahead and get your BMI and your weight and everything. Okay, just please stand. We usually don't put shoes on. She's pretty good. Okay, and I'm gonna go ahead and check your height. Okay, 5'3". Okay, so my weight was 160, my height was 5'3". Okay, I'm gonna go ahead and get your waist circumference. You can go ahead and step off now. Here it is. Okay, we're gonna go ahead and get the lowest angle. Go ahead and get into your privacy mode. We do see she has a waist circumference of 35. Okay, and then now that we did that, I'm gonna go ahead and assess your gait now. We said, you know how I told you to go stand over there? You could just stand here, and then if you can just walk toward me. And this would be 10 feet, and then just walk back with one foot in front of the other. Perfect. And you can just come back, and then we can go ahead and take a seat. Actually, let's just one more time. Sorry. We're going to go ahead and do passive and active motion. Passive is when you assist them, and active is when they do it themselves for their muscle movements. Okay, if you could just please touch your toes, we're going to be checking the spine. Perfect. I did not feel any crampers. Did you feel any pain?
Mm-hmm.
Perfect. Now we're going to go ahead and check the hips. You can just go like this. Okay, perfect. The other one. Perfect. Did you have any pain?
No.
Okay, so she did not have any crampers in her hips either. Okay, so now, sorry. Okay. So now that we did the nutrition, I'm going to go ahead and calculate the BMI real quick. Alright. So my BMI, I got 28.3. Okay. And then, so that was the BMI. Okay. All right. So now we're going to go ahead and do all the other physical assessments now that we got some of the questions over with. Before I begin, I'm going to go ahead and ask you a quick other questions, all right? When's the last time you had a bowel movement?
This morning.
Okay. Because I don't have it with me, if I did, I would document the characteristics and what I see. But because I don't, I'm gonna go ahead and ask her. You had this morning at what time?
At 8 a.m.
What kind of characteristics can you give me about it? Was it hard, normal?
It was normal.
Normal. Okay, perfect. All right. And then I'm gonna go ahead and ask you a little bit about your mobility. Are you able to transfer in and out of your house?
Yes.
Are you able to feed yourself?
Mm-hmm.
Are you able to dress yourself?
Mm-hmm.
Are you able to go to the restroom on time?
Yes.
Are you able to wipe yourself?
Mm-hmm.
Are you able to take a shower by yourself?
Yes.
Okay. So she would get 1 point for each one. So you did pass that one. Okay. So I'm going to go ahead and do 2 tests on you. First is fast test. This is for testing for stroke. First is S. I saw that her speech is good, so it's not slurred or anything. Okay. Oh no, sorry. Okay, so I see that her face is not drooping. If it was, I would go ahead and mark it. Can you put your arms up for me? Perfect. One is not drooping. Good. And then her speech has been clear. Can you repeat after me? The weather is nice.
The weather is nice.
Perfect. Okay. And if she did not pass some of these tests, I would go ahead and call 911. That stands for the T. Time to call 911. Okay. Now I'm going to go ahead and do a gas loss coma scale. Okay. So we did see that her eyes are opening and closing spontaneously. So we're going to give her 4. Her body movements have been coordinated, and she does it by herself. She does obey a command, so she's a 6. And her speech has been clear, as you can see. We're going to go ahead and give her a 5 for that. So in total, that's going to be a 15 on the gas loss coma scale. Okay. So after these 2 tests, we're going to go ahead and do a head-to-toe assessment. Are you okay with that? Perfect. Okay. All right. Sorry about that. Okay. I'm going to go ahead and I'm going to go ahead and start with her head. I'm going to go ahead and check for any protrusions, lesions, or depressions, anything like that. We see that she does not. We see that her head is normal cephalic. It is proportionate to her body size. We see that her neck is erect and midline as well. We're going to go ahead and check the hair at this time. The texture is nicely, it's not brittle, and her hair is evenly distributed around her head as well. Okay, so now that we checked the head, I'm gonna go ahead and move down to her eyebrows. We see that her eyebrows are symmetrical to her eyes. They are symmetrical as well and even. We're gonna go ahead and move down to her eyes. We're gonna go ahead and do a PERLA assessment. PERLA stands for pupils are equal, they're round, they react to light, and they accommodate. So first we're gonna go ahead and check if they are round. We do see that her pupils are round. And we do see that they are also equal in size. We're gonna go ahead and measure real quick. Without the light, we're starting off with a 5. We're gonna go ahead and provide direct light. It was when you put light directly into the eye, and consensual is when the other eye constricts as well. Okay, so we did say it started us with a 5, went all the way to a 3, and we did also see that this eye constricted as well. So it is they were equal in size as well. Okay, we do say that her eyes are even with their sockets. They're not exophthalmos, which is they're not protruding. Endophthalmos is which they are sunken in. Okay, we're gonna go ahead and check for accommodation with her eyes. If you could just please follow me. Look over here without moving your head, ma'am. Perfect. And we did see that they did accommodate. So they were round, they reacted to light, they were equal, and the size was good, and so the symmetry as well. Okay. So now I'm gonna go ahead and check, do some more assessments with the eyes. We see that she does not have any lesions, thickening, swelling around her eyes. Can you please close your eyes? We did see that there's an evenly distribution of eyelashes. There's no swelling, lesions or anything around her eyelashes as well. We do see that her eyes close completely. Can you please open your eyes? Okay. We do see that her sclera is white in color, and we're gonna go ahead and check the conjunctiva. Can you please look up for me? Perfect. We do see that there's no lesions, and it is also moist without lesions as well. Okay. So after the eyes, we're gonna go ahead and move down to the nose. We do see that her nose is symmetrical. Can you please smile for me? Perfect. We do see that her nasal labial folds are symmetric as well. The sides of her mouth are not drooping, as we looked into the FAST test as well. We do see, we're going to go ahead and assess her mouth. We see that her lips are even in color. We're going to go ahead and move down to her tongue. Can you stick up your tongue, please? And they're moist as well. Her tongue is moist. There's no patches or anything like that. We're going to go ahead and check her tonsils. Okay, so can I see your throat, please? Can you bring your tongue down? Perfect. So we do see that her tonsils are visible, which is a 1. 2 would be they're halfway between the out to the ulva. 3s are touching, they're touching the ulva, and 4s are touching each other. We do see that she does not have any halitosis. Okay, so after assessing the mouth, we're going to go ahead and move down to the ears. Okay, so for the ears, we're going to be looking if the skin is intact. We do see that the skin is intact. There's no thickening, swelling, lesions. We do not have any things, so we're gonna check for tenderness. Do you have any pain here? We're gonna pull the pinna up and down. Any pain here, the tragus? Okay. We're gonna go ahead and look at the external meatus as well. We're gonna look at the size. We do not see any cerumen present. If there was, we're gonna check the color, the amount, and the texture. Okay. And going back to the other ear as well, we're going to look for the same thing: swelling, lesions, thickening, skin is intact, external meatus, the size is pretty good, no cerumen present as well. No pain, right? Pain? Okay, perfect. We do see that her ears are equally bilaterally. We're going to go ahead and check for her tenderness and the mastoid process. Do you have any pain here, ma'am?
No.
Perfect. Okay, so we're going to go ahead and do a hearing test while we're back here. If you could just please close your eyes and just tell me where you feel. Just raise your hand. Perfect. So she did pass the finger rub test, and we do see that she's been able to conversate with us as well. Okay. So now we're going to go ahead, after we do that, we're going to go ahead and check her motor sensation and everything like that. Okay. Starting with her motor, can you please close your eyes? Whenever you feel something, just say now.
Now. Now. Now. Now. Now. Now.
Perfect. Okay. Now we're going to go ahead and check smell. If you just please close your eyes. And then you're gonna tell me what you smell. We're gonna go ahead and occlude this nostril.
Orange.
Perfect. Okay. Now we're gonna go ahead and occlude the other nostril with a different smell. Oop. Sorry. Okay.
Mint.
Perfect. So we did see that she did pass the smell test. Okay. Now we're gonna go ahead and check. Laura, can you please puff out your cheeks for me, ma'am? Okay, we did see that the air flew through the cheeks evenly and symmetrically. Okay, now we're gonna go ahead and do 3 other tests. Can you please swallow for me? Can you please cough for me? Okay, and the gag test, we don't really do it, but we would just go like this and check for gag. Perfect, ma'am. Okay, so after that test, we're gonna go ahead and move your. We're gonna go ahead and while we're at the face, we're gonna go ahead and do a temporomandibular checking for movement here or crepitus. Can you please open your mouth? Go side to side. Perfect. I did not see any crepitus. Any pain there?
No.
Perfect. Now the shoulders, can you please push up for me? Perfect. So we did not see any. We did see she has good strength in her shoulders. Can you please put your arms up like this? Put your arms down like this. And now go ahead and do them both again. Perfect. We did not see any crepitus. Or you didn't have any pain?
No.
Perfect. Okay. So now we're gonna go ahead and move down to her neck. Okay. And you can just turn your head side to side. We're checking for jugular vein distension. Perfect. So we did not see any pulsations as well. Now we're gonna go ahead and assess her carotid artery. One at a time. Okay. +2. +2. As you see, whenever we do address pulses, 0 is absent, 1 is weak, 2 is normal, 3 is bounding. Okay, so now we're going to go ahead and osculate her carotid artery. We did already clean it. And for this one, I'm just going to ask you to take a deep breath in, deep breath out, and hold. Okay, ready, set. Okay, deep breath in, out. Perfect. Other side. In, out, hold. Perfect. Okay. We did not hear any bruis or any venous noises. Okay, now we're still at the neck. We did already say that it was erected midline. I'm going to go ahead and ask you to do some range of motions for me, okay? Just please look right, left, put your head all the way back, put your head all the way forward, and can you touch your ear to your shoulder? Perfect, okay? So we did see that she had good range of motion here, and then, perfect. Okay, so now we're gonna go ahead and finish the rest of the assessment. And we're gonna go ahead and start with perfusion. I already did start grading her pulses. I'm gonna go ahead and check for edema. Okay, you see there's no edema on the wrists. Perfect, now we're gonna go ahead and check edema on the feet. Okay, there's no edema on the feet as well. Rating edema, 1 is mild, 2 is moderate. 1 is mild, 2 is moderate, 3 is deep, and 4 is very deep. I don't know if you want to put the phone to charge. Just move it this way. Sorry, I'm gonna put the phone to charge real quick. If someone's not taking my charger. Okay. Okay. Sorry about that. Okay, so now it is charging. Yeah, it should be charging. Okay, so I'm sorry. Going back to perfusion, we're gonna go ahead and check for tenderness, temperature, color, everything like that.
You were in edema.
Edema? Oh yeah, I did finish grading the edema. I don't know if y'all heard the last part. 1 is mild, 2 is moderate, 3 is deep, 4 is very deep. Okay, going back to perfusion, we're gonna go ahead and check for any tenderness. Just tell me if you feel any tenderness now.
No.
Okay, going back to your hands. Hala. muscles in your hands. And back to the other one. Okay. Any tenderness on your legs, ma'am?
No.
Perfect. Okay. And then of course the little muscles on your feet. Other side. Perfect. Any tenderness? Perfect. Okay, we're gonna go ahead and check for muscle symmetry as well. Okay, please put your arms out. We do see that her muscle tone is symmetrical in all sides as well. I'm gonna go ahead and assess for her color. We see that her color is good for her background, her hyperpigmentation as well. We don't see any paler, cyanosis, pink, redness. It is normal for, of course, for her genetic background as well. We're gonna go ahead and assess for hair distribution in the extremities. We have even distribution in her extremities. There's no patches or anything like that. We're gonna go ahead and assess for her capillary, her nails. We see that the nail bed is nice and even. We do not see any clubbing. We're gonna go ahead and check for capillary refill. Okay, it is less than 2. And then, yes, her capillary refill was less than 2. Okay, and then contour is not bit into the quick, jagged, or zigzagged or anything like that. Okay, so now we're gonna go ahead and do some other range of motions while we're here. I already did the shoulders. I'm gonna go ahead and assess your elbows. If you could just please go like this. Do you have any practice?
No.
Perfect. Okay, if you could just please pull against me. Oh, with your elbows. And push. Okay. We do see we have good strength in her muscles. And we're gonna go ahead and check upper body strength. Just pull. Perfect. We do see we have good upper body strength. Now for your wrist, just go like this. Any practice, ma'am?
Yeah.
And for your fingers, can just go like this. Perfect. Any pain? Okay. So now we're gonna go ahead and move down to her knees. If you could just go like this, in and out, both of them. Perfect. I did not see any crevices on her knees. Did you have any pain, ma'am? Okay. And if you could just push against me. Perfect. And pull. Oh, perfect. Okay. So she does have good knee strength as well. Okay. For her feet, we're gonna leave that last whenever she's over here. Okay. So also for we're gonna go ahead and assess for temperature. Okay. We do she is not hypothermic, hyperthermic. It is warm. Okay. So do you still have any questions for me, ma'am?
No.
Perfect. Okay, so now that we assessed perfusion, we're gonna go ahead and finish assessing other things. We're gonna go ahead and move down to respiratory. Okay. So let's go ahead and move down to respiration. Checking the arteries of the heart. Okay. So we have the aortic. We have the pulmonic. Erb's point is right in between. I'm sorry. Okay. Erb's point is right in between. Okay. And then if you please lift your chest. We have the tricuspid. And then we have the mitral. Perfect. Okay. So now we're going to go ahead and check for respirations. Usually this is, we listen for 3 cycles, but for this we're just going to listen to 1. Okay. So just deep in and out. Okay. Okay. And just lift your breast. One more. Perfect. I'm going to go ahead and move down to her posterior side. Okay. Okay. Just breathe in, breathe out as well. And one more. Perfect. Okay, we did not see any crackles, anything like that. Now that we're back there, back here, I'm gonna go ahead and assess for tactophromidis. Just say 99.
99.
Every time I put my hand on you, I'm sorry.
99. 99. 99. 99. 99. 99.
Say it again.
99. 99.
Perfect. We do see that she has even vibrations in all quadrants of her chest. We're going to go ahead and do another test called the costovertebral tenderness. This is checking for kidney inflammation. Okay, just tell me if you have any tenderness.
No. No.
Perfect. Now we're going to go ahead and check chest expansion. Okay, breathe in. Perfect. We see that our hands did move in symmetrically, so she does have even chest expansion. Okay, so now that we finished here, we're going to go ahead and check for barrel chest. We do see that she has a 1-to-2 ratio. If she did have COPD, it would be 1-to-1 or 2-to-2. Looking at her sternum, she does have a normal sternum. It's not pectus excavatum, which is a sunken in sternum, or pectus carnivatum, which is a protruding sternum. Okay, so now that we did the chest sounds, we're gonna go ahead and give me a second. Let me go ahead and do some paperwork over here. We already did get the rate of the respirations, and then we saw that her pattern was evenly distributed as well. Okay, so now we're gonna go ahead and move down to pulses. So we already did grade both pulses. We're gonna go ahead and move down to brachial. +2. +2. Her radial. +2. Her ulnar. +2. Radial. +2. Ulnar. +2. For Mara, we usually don't do. I'm gonna go ahead and move down to her popliteal. +2 and +2. Moving down to her feet, we're going to go ahead and look at the posterior tibialis. +2. Her dorsopedalis. +2. Moving back over here, posterior tibialis. +2. Dorsopedalis. +2. So we did see good pulses as well. Okay, so let me just go ahead and move over here. So mobility. So now I'm going to go ahead and we're going to go ahead and cover elimination. Okay. So I'm just going to ask if you can please lay down for me.
Okay.
Perfect. And earlier I don't know if I mentioned, but she had good muscle tone and symmetry. Yeah, I did mention that. Muscle tone and symmetry. So, are you okay?
Yes.
Alright. Okay. So we're going to go ahead and check over here. Ooh. Okay. So first we're going to go ahead and inspect. Is that okay? Oh, okay. So you could just please put your arms down. We are inspecting for any pulsations from the chest all the way to the abdomen. We do not see any venous pulsations. We do not see any shadows. We would usually do this without an undershirt, with an undershirt or bare skin. We don't see any shadows or any venous patterns as well. Okay. So we are also looking for the shape and the contour. She's flat, she's not scaphoid, protuberant around. We don't see any striae, any different color variations as well. Okay, and a venous pattern, there's nothing right there. Okay, so everything looks good on the inspection. Okay, now after that, we're going to go ahead and osculate. Before I osculate, I'm going to go ahead and mention some things that are in every quadrant. Right lower, we have the appendix. Right upper, we have the liver. Left upper, we have the stomach. Left lower, we have the descending column. Midline, we have the bladder. So we're going to go ahead and osculate. We're going to be looking for bowel sounds. Okay. So starting from the right lower. We do see we have good bowel sounds in all quadrants, so they are normal, active, they're not hypo or hyper. Now we're going to go ahead and osculate her arteries in her stomach using the bell. Okay. Okay, starting with the aortic. We have the renal. We have the iliac. Okay. And then the femoral, we usually do not, we're not going to go assess that. We did see that we did not have any bruits or venous patterns as well. Okay. So after osculating, we're going to go ahead and percuss. We're percussing for tympani and dullness. Tympani is air. Dullness is if they have like fluid, a mass, like a fecal part, any distension in there. Okay. Tympani is air. Okay. So we have tympani. Now we're going to go ahead and do a shifting dullness test. This is checking for ascites. Starting from over here. We do see that we start filling the dullness right here. I'm going to go ahead and put a mark. And then for the rest of the test, she would move to her left side, and then we would go ahead and do the tympani to dullness again, and then mark it as well to see if there's any ascites, if the line went over the other one that we just did. Okay, so that was shifting dullness. Now after percussing, we're going to go ahead and palpate. Starting from the right lower, we're checking for tenderness and distension. If you have any tenderness, just let me know, okay? Okay. We did not feel any distension. Did you have any tenderness, ma'am? I did not feel any masses as well, okay? So after that, we're going to go ahead and do a test called the Iliopsoas. This is for checking for appendicitis and even for lower stomach pain as well, okay? If you could just raise this right leg without bending your knee and just push against my hand. Any pain right here? Perfect, so she did pass it. Okay, so now we're going to go ahead and, I already asked her about her elimination. We're going to go ahead and do some more things that we're going to do over here. I'm going to go ahead and check her ankles. If you could just go like this, ma'am. Okay, we do so. She has a little bit of crepitus on her left, but now we're going to go ahead and check for lower body strength. If she could just push against my hands. Perfect, and pull, push. Perfect. She has good lower body strength. Okay, and then I think I already did explain active and passive movements. Let me just go ahead and go back to my paperwork. Okay. Let me go ahead and sit right here. Do you have any questions for me, ma'am? No. Okay, perfect. Eyes, ears, nose, and throat. Okay. And no other pain, ma'am?
No.
Okay. And we did do the perla, the nose, everything like that. Okay. And so I'm just gonna go ahead and revise my BMI really quick now that we're here. Okay. Let me just get my calculator. Here it is. Okay. I'm just going to go go ahead and put my weight in kilograms. So you were 160. 60 divided by 2.2 equals 72.8. So that here is our kilograms. Okay. So without any other further questions, do you have any questions for me?
No.
Perfect. Okay. And I am done.